Thank you for joining this evening. I appreciate your participation in this telephone town hall. Before the protests started and rallies and marches across Virginia and across the country, we were witnessing discussions about equity and justice as it related to who was in our hospitals and who was in our morgues. COVID-19, according to the data, is infecting and killing Black Americans at disproportionate rates compared to all other ethnic groups. In Virginia, in particular, African Americans are 23.8% of the deaths to COVID 19, but they represent 13.6% of our population here in Virginia. So we wanted to have this town hall to discuss some of the reasons why we're seeing this disparate impact, what it means for our community, our country, and how we can save lives. And while much of tonight's conversation will focus on elements of that disparate impact, this is part of a much larger conversation and a discussion about COVID-19. Our fifth conversation about COVID-19 in our town hall series. And it's also part of a larger discussion about healthcare in America and how we can all work for a more just and equitable society in times of crisis like COVID-19 and outside of the emergency of a pandemic. While I do miss having in-person town halls, I'm grateful for the technology that allows me to connect with all of you, and it permits me to bring three special guests to tonight's conversation. So I'm going to begin providing some brief introductions and then open it up to each guest to provide some opening remarks. We will begin with Congresswoman Lauren Underwood. Congresswoman Underwood represents Illinois' 14th congressional district. She was elected in 2018 at the same time that I was. She has a background in healthcare policy. She received her undergraduate degree from the University of Michigan in nursing. She went on to get 2 master's degrees from the Johns Hopkins University. She worked in healthcare policy with the Obama administration before becoming a senior advisor for Health and Human Services. She is an incredible member of Congress. She is the youngest Black woman ever elected to Congress. She brings her tremendous knowledge about healthcare policy, her passion for her constituents to Congress every day. She's also a Gold Award winner for those who know that I love the Girl Scouts. So I'm proud that she's a fellow Girl Scout. She's also the founding member of the Black Maternal Health Caucus. And she founded this caucus in Congress to bring special attention to issues of health disparity, particularly for women in their childbearing years. I could say so much more about what an incredible member of Congress, person and friend she is, but I'm grateful to have her join and have the constituents of Virginia's 7th District get to know another member of Congress a bit more. I'll pass it over to you, Representative Underwood.
Well, thank you, Congresswoman Spanberger, for the invitation. I am so delighted to be with all of you this afternoon. To my fellow panelists, Dr. Underwood and Dr. Winn, hello, and hi everybody who's joined today's town hall to discuss this topic during a profoundly difficult time. In recent weeks, we've seen protests and demonstrations expressing the deep pain, hurt, anger, and frustration of systemic injustices, excessive use of force by police, and the deaths of George Floyd, Breonna Taylor, and Ahmaud Arbery. These deaths come in the midst of a pandemic that has not affected all communities equally. In April, the Centers for Disease Control and Prevention reported that Black Americans have been hospitalized from COVID-19 at disproportionately high rates. The COVID-19 Tracking Project found that Black Americans are dying at a rate nearly 2 times higher than our population share. And in my state of Illinois, Black people make up 14.6% of our state's population, but nearly 30% of our state's COVID-19 deaths. I know that similar trends are emerging in Virginia. These statistics are reflective of broader health disparities, which we see across indicators, including maternal health outcomes. Black women in the United States are 3 to 4 times more likely to die from pregnancy-related complications than white women. We need swift and bold action to address these inequities, and that's why I'm grateful for Congresswoman Spanberger's leadership on Black maternal health ever since we arrived in the House of Representatives together. The Congresswoman is a member of our Black Maternal Health Caucus and an original co-sponsor of the Black Maternal Health Momnibus Act of 2020. We're continuing our ongoing work together to promote health equity, now addressing disparities in COVID-19 outcomes, disparities that demand serious policy changes. And that starts with data collection. I'm grateful to Congresswoman Spanberger for joining me on a bipartisan letter to Secretary Alex Azar to ensure that we are collecting and reporting all necessary COVID-19 data, particularly in the context of maternal health. The letter also ensures that studies on the pandemic's effects on women during and after pregnancy include racially, ethnically, and geographically diverse participation. We also need targeted health interventions that provide the resources that local health departments and communities of color and underserved areas will depend on during this pandemic and beyond. Finally, we need to ensure every American has access to affordable health care. The stakes could not be higher. In the midst of a global pandemic, the Texas versus US lawsuit could cause 54 million Americans to see their pre-existing condition protections eviscerated. We need to protect health care for people with pre-existing conditions, and we need to continue the effort to roll back junk plans that don't offer protections or access to needed care. We also need to ensure that people who need affordable health care can get it. And that means reducing the cost of insurance premiums for the Affordable Care Act plans by expanding tax credits to more people and making them more generous. It also means addressing the skyrocketing out-of-pocket costs for healthcare that Americans rely on, like prescription drugs, which Congresswoman Spanberger has championed with her bipartisan Public Disclosure of Drug Discounts Act. COVID-19 is a once-in-a-generation crisis that will change our world forever. But it's also a once-in-a-generation opportunity to catapult us into a stronger health system for everyone. I look forward to today's conversation and turn it back over to Congresswoman Spanberger. Thank you.
Thank you so much, Congresswoman Underwood. You are so kind, and thank you for your kind words about our work together in Congress. Next up, I will be introducing Dr. Janice Underwood. No relation to Representative Lauren Underwood. Dr. Underwood was appointed by Governor Northam as the Commonwealth of Virginia's first cabinet-level Chief Diversity Officer. This position is, in fact, the first of its kind in our nation, and as the Commonwealth CDO, she is committed to addressing racial, ethnic, disability, gender-based, and other cultural inequities in formal and informal policies and practices here in the Commonwealth of Virginia and in state government. Her goal is to make Virginia an exemplar for the nation regarding diversity, equity, and inclusive excellence. Dr. Underwood.
Thank you so much, Congresswoman Spanberger, and thank you for that wonderful and kind introduction. And Congresswoman Underwood, thank you for your words. I think you summed it up beautifully. I'll just add, though, that as the nation's first cabinet level Chief Diversity Officer, we are really thinking about how do we make the Commonwealth of Virginia more inclusive and welcoming to all. I do want to offer everyone who's watching and listening warm greetings and virtual hugs from the governor and Mrs. Northam and the entire administration. We know that we are in a global pandemic, and some of us are in a pandemic within a pandemic. And that has not been more clear, never been more clear to me and the administration and the governor in particular. We are certainly in this storm together, but we're not in the same boats. And so the Health Equity Working Group and my leadership team, who leads the Health Equity Working Group, is really thinking about how do we prioritize equity, which means how do we help those who need the most help, who have historically been marginalized and underrepresented and under-resourced. And that is why we were formed at the very beginning in a proactive way at the top of the Virginia Unified Command structure. The Health Equity Task Force is really the first of its kind of task force in Virginia state history and nationally to exist within an emergency response body. And the nearly 60-member Health Equity Working Group serves as a cabinet-level mechanism to apply a health equity lens to the Commonwealth of Virginia's COVID-19 response. Now, some of you may be thinking, why is that important? Well, it's important because the Commonwealth of Virginia was the first state to create a health equity task force that really prioritizes not equality, but equity. Because we know that there are certain people that don't have the same boats in this storm. And we know, based upon what the data shows us, and Congresswoman Underwood laid it out so beautifully, that communities of color, particularly Black, Brown, and Native communities, are burdened by this pandemic more than anyone else. We know that the Black community has the highest death rate, but the Hispanic and Latino community have the highest positive case rate, particularly in Northern Virginia. So every other COVID-19 equity task force around the country was actually built reactively after the Virginia model. And that's something that we can be proud about because we're leading the way and we're showing that we can link arms with other states because we are all in this together and share best practices. Our task force in the Commonwealth of Virginia, the Equity Task Force, is not an intellectual or academic task force. These aren't just theoretical exercises for us. Virginia is the only state with an operational task force. We use a whole government approach, and that is very novel because we know we need something as novel as this coronavirus so that we can make sure everyone has what they need. I also would like to share with you that the Equity Task Force is spearheading what we call local state government partnerships, where we are going around to every state or county in the entire Commonwealth using data through the Health 360 framework from Deloitte. And we're saying, who needs the most help? We know that everyone doesn't have the privilege of social distancing in their home. And we know that there are underlying conditions that people have that make COVID-19 not only complicated, but deadly. So we are going directly to those neighborhoods and those homes, and we're trying to say, what do you need? And we are partnering with those local communities to provide oftentimes 20,000 masks, 20,000 bottles of hand sanitizer, culturally affirming information and education materials in every language that we need to have it translated in, because we know everyone doesn't get the same information the same way. So we're trying to partner with those who need the most help, because we know it's going to take all of us to get through this together, and we are ready to serve. So thank you so much for having me, Congresswoman Spanberger, and I'm happy to be part of the conversation.
Underwood, and I would now like to introduce Dr. Robert Winn. So recently, Dr. Winn, Dr. Underwood, and I all joined together on a joint op-ed that ran in the Richmond Times-Dispatch, where we drew upon some parallels, particularly given Dr. Winn's experience as a pulmonologist and cancer researcher, and he's currently the director of VCU's Massey Cancer Center. He comes to VCU from the University of Illinois at Chicago, so not so far from my colleague, Congresswoman Underwood. And at the University of Illinois at Chicago, he served as the director of the Cancer Center there and the Associate Vice Chancellor of Health Affairs for Community-Based Practice. At UIC, he built a community to bench integrated health model that brings together both the discovery and implementation of sciences into one health delivery and research system. And he oversaw the research and clinical activities of 13 federally qualified health centers. Now at the Massey Cancer Center at VCU, he is proud of the fact that Massey is Richmond's only National Cancer Institute designated cancer center and Virginia's first. And it's also among the top 4% of cancer centers in the country to earn this prestigious designation. Dr. Winn is so kind to join us today. His experience as a physician and particularly as a pulmonologist, given the way that COVID-19 ravages the body, is so valuable for him to be part of this conversation. His focus on health equity and work in the community is so valuable. Dr. Winn, thank you for joining us, and I'll hand it over to you.
Oh, first of all, I'd like to say thank you, Representative Spanberger, and also Representative Underwood and Director Dr. Underwood for your leadership. It's not lost on me that as we're looking and marching into the 21st century, that this even panel that we have looks very different than it would have looked maybe 30, 40 years ago, even 20 years ago. Having said that, this pandemic and the current protests have really brought together an intersectionality of thoughts for me, thinking about where we're going. The truth of the matter is, in 2020, I remain the only African American cancer center director in the country. We've made some progress, but we certainly have more progress to make. I would say the same thing is probably true for where we are at this moment. We talk about many of these things, the protests that we're doing now, the structural issues that we have, the pandemic that we have, as being something that only happened now. If we go back to as far as 1918, we've learned some lessons from that pandemic, but we certainly have more to learn now. If we go back in time, we also recognize that some of the issues that we'll even talk about tonight that are fueling the issues around this pandemic, poor education, poor housing, issues around structural violence issues, whether it's policing or whether it's transportation. It's not the first time we've actually had those. In fact, over 100 years ago, W.E.B. Du Bois was the first to write something in the Philadelphia papers actually describing all of the issues that we somewhat have today, which is contributing to worse outcomes for certain populations of our people. Having said that, I have immense hope, and I'll keep my comments short because my cup runneth over with in a time where most people are saying what is going on. I'm sort of saying we finally have awakened from our slumber, understanding that we probably took many things for granted, and we can no longer do that. We are on the verge of being able to make certain that we're taking care of pandemic patients, and we can talk about more about that later. But we certainly have developed in this pandemic a drug that is effective, and we're working on a vaccine. But most importantly, what's actually kept this pandemic from being even worse, just individual people being able to do social distancing, being able to be respectful by wearing masks. And I know it sounds somewhat 14th century in its sort of approaches, but it's proven to be very effective. I actually look as we're moving into the fall and the winter that while we'll certainly have a rough patch, I certainly am confident that we'll be coming out of this and coming out of this much stronger, not only in the context of being able to deal with the COVID-19, but I actually think we're going to come out strong as a people. So I am cautiously optimistic, but nonetheless, doing the work of rolling up our sleeves, making sure that our ICUs and our clinics are all in high functioning order to make certain that we can serve. So I want to thank you all tonight, but certainly I want to thank Representative Spanberger for putting this panel together. I really do appreciate what you're doing and your leadership.
Thank you. So at this time, I will turn it over to the moderator who will begin taking your questions.
Thank you very much, Representative. And just a reminder, if you would like to get into the queue to ask a question, just press *3 on your telephone keypad if you're on the phone, or if you're streaming online, you can submit your questions below the streaming player. Also, if you'd like to receive updates from us via email, please press *6 on your phone keypad at any time, and an operator will collect your email address. So moving on to questions from people that have pressed *3, we've got Jeanette on the line. Go ahead, Janice. You're live on the call. What is your question?
Yes, I was just wondering about the, I thought it was another CARES Act package coming out for later in the month to continue with the pandemic because everything is still either half shut down or where we go at, we can't go. And everything, it seems like the grocery stores are just taking up stuff unnecessary, I guess, because if things are like they are. Everything seems like it's higher.
Okay,
Comment briefly on, yes, I'll comment briefly on Jeanette's comments. So as of right now here in the Commonwealth of Virginia, We are entering phase 2 in most portions of the Commonwealth in our reentry plan as we enter back into the economy. There are some locations where they've been particularly hard hit by COVID-19 that are being a little bit more tempered in the opening of businesses. But Jeanette mentioned grocery stores and that things are higher and higher. And I think she's speaking to the challenges that so many are facing across our communities, which is as we're returning to a bit of normalcy, it is difficult for us to know kind of the next steps. Here in the Commonwealth of Virginia, it is required to wear a mask inside. That's a CDC recommendation, and it is also a requirement here in the Commonwealth of Virginia for the public safety and public health reasons that Dr. Winn mentioned. As far as future legislation, because Jeanette mentioned that, currently we are looking at future next steps for federal relief. One of the areas that is a major priority for me, and I believe it is for my colleague, Representative Underwood, as well, is to provide support to our communities and localities in the same way that we've provided support to individuals and small businesses. So many of our communities, our local governments are really struggling from the financial impact, and that impacts all of us.
Thank you very much for that answer. Next, we've got a question coming from online. Tom asks, can you help us to achieve publishing of nursing home and other care facilities ratings and complaints in Virginia? This would be a first step towards transparency in healthcare, which uplifts everyone.
So this is a priority, the issues of nursing homes, certainly here in Central Virginia, as we have seen real tragedy in the nursing homes here in the 7th District. But I'm going to open it up to my fellow panelists if they'd like to begin the conversation so that we can hear from them.
Director
Or I'll begin.
Underwood?
Well, I'm happy to jump in. And then maybe Dr. Winn, I didn't mean to interrupt you. I certainly will yield and acquiesce to your leadership in this area. This is an issue that is on the tops of everyone's minds, especially as we think about the outbreaks in the long-term care facilities. In fact, we know that it is such an extreme issue that the governor created a long-term care working group, a specific task force that looks at how do we prioritize what's happening in the outbreaks in the long-term care facilities, as well as protect the residents and the workers, and how do we mitigate spread. And that work group is then it includes stakeholders across the entire Commonwealth. That includes long-term care facilities and leadership, as well as epidemiologists and the hospital associations. And so we are prioritizing long-term care and really congregant settings in general, because we know that the potential for spread is so high. But we also know, and this is something that shouldn't be lost on folks, is that we're also learning that those long-term care facilities that are primarily hold people of color or those in lower income brackets are hit even harder than others. And so we need to make sure that our sanitation is prioritize the sanitation methods, that we are providing our long-term care facilities with the PPE that they need, and all the measures to protect the residents and the workers and the public. And so I think your question was really about how do we then prioritize a transparency? And that is something that I think we're all struggling with. But I'm hopeful that we're going to see changes in that area. But right now, we also have to keep the confidentiality of our residents at the top as a top priority as well. And so how do we mitigate between transparency and confidentiality of patients? And so that's really where I am. And many of us are struggling on how we mitigate both of those. Dr. Winn?
I'd agree. And to repeat, I think that your VAs, your transition places, your long-term facilities for nursing homes, but also your correctional facilities. I actually think that, again, being both in Illinois now and in Virginia, that it's clear that the long-term facilities where we house our veterans and the correctional facilities all need attention. And they also need some sort of ranking, which is what I think you're trying to get at, is which ones actually are the really hot spots and which ones are just simply the hot spots with maybe lower rates. I think that doing that is actually obviously in the good of the public health. But once we get beyond the public health, that's going to be laws and regulations and legislations, which is actually beyond my pay grade as a doc. So, but I absolutely think that is a very good ideal and pragmatic of recognizing of those facilities, which ones are at higher risk, because the more you know, the better you're able to intervene. And honestly, early intervention is really the key to having a good outcome.
And at the federal level, one of the priorities, so CMS has the ability to provide additional information to the public. And I've advocated for, and I believe Representative Underwood has as well, for CMS to provide some basic information that helps family members make determinations and have greater clarity related to the facilities where their loved ones may be, who the medical director is, where that medical director serves, how long that they have been there. And providing some clarity in terms of what is the attention to infectious disease control. Notably, last year, the administration did announce intended changes to their rules that would move us backwards from the perspective of how to control for infectious diseases in our nursing homes. And so I have been part of an effort calling on CMS to not make those intended or announced changes, particularly during a pandemic, though I would argue they shouldn't be made at all. And I have had one-on-one call with CMS Administrator Seema Verma to speak very frankly about what we're seeing here in Central Virginia. We have had nursing homes and long-term care facilities that have suffered the significant numbers of fatalities, and those are loss of lives and loved ones. And so to the caller's question, part of this is about transparency, so that when there's transparency, there's accountability, that these facilities are recognized, that the information's out there in terms of deaths or infections, or even basic information like, do they have a full-time medical director that's focused on their needs? And this is a really important piece of it. That transparency leads to accountability and helps people make good decisions for their family members, and brings into the light facilities that may be facing trouble where change is necessary. And to Dr. Underwood's point, with the governor's task force focused on congregant facilities, that information being available to the public is valuable for the work of that task force as well.
Moving on to the next question, we've got Linda joining us on the call. Linda, you're live. What is your question?
My first question is this, and I'm not sure if it was Dr. Underwood who said that they're passing out information to different groups. There's a lot of people who do not understand and maybe can't read, and it's a little embarrassing to them. Do you explain everything to them about COVID-19? Because what I am seeing in my community, there's a lot of people, even the store owners, are letting people in. They're not wearing masks. And I thought Governor Nordstrom, they said when we open up, if you go inside, you must wear a mask. And they're not doing that. And my next question was, we need to give some of the neighborhoods that don't have good grocery stores, they're not getting good food. We were raised to eat good, take care of your body, take care of yourself. Your body's a temple. And a lot of the neighborhoods in our cities, they don't have any grocery stores, because I have worked in the city. I have taken people on another side of town to do grocery shopping. So I think they need to figure out a way to put good grocery stores and good food into some of those neighborhoods.
Well, thank you, Linda, so much for your question. Dr. Underwood, would you like to address Linda's first question about the way that you're distributing information, or the way the governor's office is distributing information and the accessibility of it?
Yes, thank you, Linda, for that question. One of the priorities of the Health Equity Task Force and my team in particular is about getting information to those who need it, as well as being able to be received by everyone. And so part of our communications plan has been to use varied and multiple modalities. And so we don't always rely on the written word. While we do hand out flyers and door hangers, and we are passing out PPE in areas that are under-resourced, we're also relying on other mechanisms. We're relying on social media. We're relying on commercials. So you may have seen commercials that pop up while you're watching television that says Virginia's health is in your hands. We're also using radio, and we're using radio across a continuum. So whether it be Latino radio, whether it be African American stations, gospel stations, whether it be rock and roll stations or R&B stations, news stations, also billboards. As you drive by, we are also using anything that we can get the word out. So I really do hear what you're saying in terms of how do we get information to those and pass out information to those who can't read. And as a former special education teacher who taught students a love of science, I knew, and I always know and center this idea that everybody doesn't get their information the same way, and everybody is on a different reading level. But what I also know is everyone doesn't speak the same language. And so English is always not the first language or preferred language of every resident in Virginia. So I'm also taking into account language differences. So you should know that we are prioritizing how we get education materials out to everyone because we want everyone to follow the wear a mask mandate. But you should also know, Linda, that everyone doesn't feel comfortable wearing a mask, and we know that is true as well. We know that we've heard that African American males don't feel comfortable wearing a mask because perhaps they will be viewed as a threat. And the very thing that is intended to save their lives could possibly cost them their lives if someone feels as though they are just shopping with a mask on and they are threatening to someone in law enforcement or someone else. And so we do encourage everyone to wear a mask. And so now we're creating a mask campaign so that we can socialize the public to wearing a mask as well. And so those are some of our top priorities. And I'll pass it back over to the representatives to talk a little bit more about, I think you talked about food deserts. We know that grocery stores aren't available to everyone and fresh food isn't available to everyone. So I'll pass it back over.
So I'll start here, but I might give Representative Underwood a chance to speak a little bit to food equity, to food deserts. In the district that I represent, there are food deserts present in parts of our suburbs and particularly in our rural communities. And the impact on access to food is incredibly important to someone's long-term health. But Representative Underwood, do you want to speak to this topic? Given your background in healthcare and the related nature of food stability and security and health?
Sure. We know that nutrition is a social determinant of health. And for individuals who don't have access reliably to fresh and healthy food sources, they're more likely to have heart disease or diabetes or high cholesterol, just all these different impacts. And so we want to make sure that in a time of a pandemic, when these types of pre-existing conditions put folks at higher risk for more severe illness, that access to nutrition is not something that is putting certain communities at such a disadvantage. One of the things that we've seen is there have been shortages at our food banks, for example, here in Northern Illinois, and food banks that had prided themselves at never turning folks away due to the swift dissension into an economic crisis as a result of, business closures and the stay-at-home orders, now our food pantries have faced such an increased demand. And so one of the things that I think is so important, the CARES Act did make an early investment, well, Families First, which was the second large supplemental spending bill we passed, and the CARES Act made some investments that would help our food pantries. The HEROES Act, which we passed out of the House of Representatives in mid-May, really just builds upon that. And so that in communities that we have a lot of people that have these kinds of nutrition needs, people who may not be able to afford high cost fresh fruits and vegetables will be able to support those local food banks and food pantries to distribute those foods to students, that food to students and families. The other thing I just want to mention is a lot of the schools have been doing the distribution of meals. And we have changed the requirements so that families with any child under 18 can come in and access that food. And so that's what we have available to us in Illinois, I assume, but don't know that it's available to you as well in Virginia. And, you know, those nutritious school-based meals also have the fresh fruits and vegetables, which are important parts of all of our diet. Thank you so much for your question.
And the counties across the 7th District of Virginia have been very responsive. As Representative Underwood was saying, we expanded and made it easier for families to be able to get those school-provided lunches when students are not in school. And our counties have been very responsive and providing thousands upon thousands of meals a day across Central Virginia. But I also would note anyone who is experiencing food insecurity at this moment, on our website, spanberger.house.gov, we have a resource guide related to food, nutrition, and nutrition security, food security. And I would also mention that Feed More, which is a large regional food bank that serves the majority of our district, on their website, you can find a food pantry near you if you are in need of assistance currently. So we've got a resource guide on our website, or you could also look at feedmore.org. But thank you so much for those answers.
Next up, we've got Deborah coming online. Deborah, go ahead. You're live with Congresswoman Spanberger and our panel of experts.
Thank you all, first of all, for your time, your wisdom, and your commitment to our community. I really appreciate you all. My question is that with a large group of people coming out together to protest and unable to keep a social distance, there's been some concern about whether or not, as we are going into, here in Virginia, going into phase 2, whether or not there is going to be a concern for a large increase in COVID-19 reigniting and it making headway. And I guess my question is there anything that we can do to mitigate, just other than wearing masks, to make sure that we don't go back to the initial pandemic level and having everything shut down?
Deborah, thank you for that question. And I'm going to ask Dr. Winn if he'd like to begin to speak to that.
I would be interested in if Representative Underwood, if you wanted to, talk about that, because, I have my ideas, but I'd like to hear, others on this panel too.
Sure. So,
because mine may not be so.
No. I'm sure you're right on point, Dr. Winn. Hi, Deborah. It's nice to hear from you. So this is what we're recommending. I think it's very important for folks who are protesting, who need to, make sure that they're fully participating in this civil discourse that's going on in our country right now, to make sure that we are using our hand sanitizer, taking the opportunity to social distance when we can while marching, and then taking the opportunity to go and get tested. The COVID test is more widely available across our communities. In our state of Illinois, it's available to anyone, whether you're symptomatic or not. But now most states have expanded their criteria so that if you participated in a protest, you meet the criteria to go get tested if it's not wide open. So Dr. Underwood or Representative Spanberger can speak about the specific requirements in Virginia, but just know that we are, and the healthcare experts, the CDC, everybody's recommending that if you have recently participated in a protest, go get tested. And then if you know a protest is coming up and you really want to participate, but you're not feeling well, stay home. If you have a fever, stay home. If you have a cough, stay home. There are ways to engage. There's ways to be an activist. There are ways to let your voice be heard without potentially exposing other people to COVID-19.
And
Thank you, Representative Underwood. That was a great answer. And I would say, just having participated in some of the marches around our district, at many of them, there have been people standing along the way to wave people on. That's a great way to be able to keep a real strong distance. People have also driven by the events and rallies and honked their horn. It's not the same, but certainly if you are feeling symptomatic, or if you are worried about potential exposure, that's an important thing. Masks, hand sanitizer, and real efforts to keep as far apart of a distance. At this point, and to speak to the testing part, I think it's important to note that in the Paycheck Protection Program and Healthcare Enhancement Act, which might be one of the longest bill titles we've had recently for our COVID response, we actually allocated $25 billion to assist states with testing. Of that, about $11 billion has been distributed. About $200 million, according to the latest numbers I have, has come to Virginia. Virginia has been expanding its testing regularly across the board. The initial goal marker that we sent was 10,000 tests a day. We are going to want to move to a place where we're testing far more people than that, but we have begun reaching that goal on a regular basis, and so I look forward to the next marker for engagement. The Virginia Medical Reserve Corps has been very active with testing people throughout the community. We've had pop-up testing sites available. To an earlier point, particularly within the 7th District, there's been clusters of COVID-19 infections within particular communities. So there's been drive-through testing opportunities in different places throughout the district and throughout Virginia as a whole. So to Representative Underwood's point, if you have any concerns, if you've participated in a protest, the recommendation is that you do get tested. If you have any feelings that you're not well, please stay home. But in terms of the recent spikes, as of right now, the data I was reviewing, and I might ask if Dr. Winn has seen anything different, there's no current spikes related to, or at least attributed to, any efforts of the protest. There are some states that are experiencing some spikes, but that has broadly been attributed to Memorial Day related events. Would anyone add anything else to that?
Sure. Can you hear me? I would probably add to that it was already something that we in the medical field have been anticipating and counting on dealing with, and particularly in the fall and the winter, that we're going to have a little bit of a spike all over the country. It's somewhat surprising and not surprising at the same time that we have spikes in places like Texas, we have spikes in places like Arizona. Many of those places did not actually have the same type of approach to social distancing as Illinois and Virginia and other places like that put into place. The only thing I would say is that I think that as people are protesting, you all hit on an important point. What is the plan to have increased tests? We initially were thinking about our tests in the context of a steady state, that we were going to have a phase 1 and then a phase 2, and then we may have a phase 3. And so pretty much all of our numbers have been based on that. With this activity within the streets, with this activity now of people congregating, I think we have to go back and recalculate what those numbers are going to look like. To the answer of why am I not sitting here panicking? 2 reasons. The first is, I think in the beginning of this pandemic, we had no clue. There are tests that we were running. We weren't really quite even certain whether they worked or not. Remember this fast story about the antigen test that was supposed to get done in 3 minutes, and then all of a sudden people got disappointed that didn't work. People got disappointed, and then high hopes about the antibody test, which was supposed to say, oh, you definitely have it, and then we found out that 50% of the time it wasn't right. I will tell you, though, by the fall, we're going to have some good tests outside of the PCR test, which is the standard test that we're using now. That antigen test is coming closer to reality and closer to accuracy. that antibody test that we've been talking about is still not that far away from being able to be a reality. So one, we're going to have better tests, I think, as we roll into the fall, that will be helpful in fighting this pandemic. The second thing is we do have therapies. At the beginning of this, I mean, honestly, this is probably where truth actually hurts, but I'm going to tell you, at the beginning of this, we were like, the therapy? What therapy? However, through research, and this is where I'm going to give a plug to everybody that's from the state government to the federal government, the ability to be able to actually free us up to do aggressive COVID testing in the concept of our research has helped actually identify not one, but several drugs that we definitely can lean on when we meet this thing again in the fall. The vaccine, we're working on it. If we get this done in 18 months, that will be a world indoor track record, and I'll be happy about that. But to answer your question directly, we fully expect that there's going to be a spike. What I don't expect is for the spike to be the same magnitude it was at the beginning of this, simply because we're armed with a heck of a lot more knowledge now if there is a second round, which is not a sexy answer, but it's the best one I have.
And thank you, Dr. Winn. And I'll just also add that in the Commonwealth of Virginia, we don't see that the protests will be ending, and we are actually planning for even more protests and being prepared for that. And so the Virginia Department of Health and my office are looking at and examining ways to really equip all of our health district directors in those in targeted areas where we see more protests, more so than others. And we want to have a presence there. The health directors team and the contact tracers and my team, we want to be able to be there to pass out PPE and make sure that if you are protesting and you don't have a mask, to put on a mask, and to give people hand sanitizer that may not have access to it who are protesting. And then the other thing is, I know that we want you to get tested if you participate in a protest, but we also want you to wait a couple of days too, because what we've learned about this novel coronavirus, we don't know a lot, but what we do know is that it may take a couple of days for it to show up. So you may not have symptoms, and you may have it and you look asymptomatic. You're what we call pre-symptomatic. So your viral load may take a little bit of time to show up on a test. So after you protest, I wouldn't directly go and get a test like within 24 hours. I would wait a couple of days and then get a test.
And if I can add, remember that the tests are free. So that's not a barrier to people who may not be able to pay out of pocket. And so let's make sure that anybody who has been exposed or potentially exposed at one of these protests or other community events, large gatherings, etc., takes the opportunity to go and get tested.
Great point.
All right, just a quick reminder, you can easily join Congresswoman Spanberger's email newsletter by pressing *6 on your telephone keypad. It's a great way to stay informed. Go ahead and bring our next caller on. We've got Amir on the line with us. Go ahead, Amir. What is your question?
First, thank you for the opportunity to participate. Will it be safe to go to school in September or earlier, like the president and governor mentioned? And if not, will there be options to be homeschooled until everything is clear? Also, if I'm required to attend school, will PPE be provided by the schools?
Thank you so much for this question, Amir. So I'll just repeat it. I did have a little bit of trouble hearing him on that connection, so I'll repeat it for the other panelists and anyone else on the line. Amir's question was about returning to school, whether or not students will be returning to school in the fall, what that might look like, will they be required to wear PPE, and if so, who might be providing it? So a bit of a kind of different bucketed pieces of information. And it was just this week that the governor's office did announce guidelines for returning to school, what that will look like. Our office will be providing, as we have so far, kind of updates, and on our email newsletter, kind of run through what this new policy out of the governor's office is. and noting that Dr. Underwood is not the Secretary of Education, I'll ask if she wants to kind of give an overview of things coming out of the governor's office as it relates to returning to school in Virginia.
Yes, and thank you. And thank you, Amir, for the question. I want to say that the governor and the state superintendent, Dr. James Lane, mentioned on Tuesday that we will open up our schools according to all schools will open up for all students next school year, but instruction will look very differently, and we will be required to deliver new instruction to all students in a different way. Some of that will happen in person, and some of that will happen via remote learning. Our opening plan does align with our phases with the Forward Virginia Blueprint. And so what it does is that the 3 phases scale up opportunities for in-person instruction beginning immediately. What's interesting, though, and what we were able to do, we had a task force, a K-20 task force, so that we had the pre-K through 12 task force, and then we had a higher ed task force. And for the pre-K through 12 task force, what they did is they really wanted to address the health, social, emotional, and physical well-being of our students and staff. And so we prioritize the needs of our most vulnerable learners. Again, I would just say that we prioritize equity as opposed to equality. So those most vulnerable learners for whom in-person instruction is most essential is prioritized. And so the 3 phases, we have a phase 1, phase 2, and phase 3. And I would almost say we have a beyond phase 3, if you will. So phase 1 is really about providing support for special education programs and childcare for working families. But as you know, we are currently, most of the state is in phase 2. And phase 2 is all of phase 1 options plus preschool through 3rd grade students, English language learners, or those who do not speak English as their first or preferred language, and summer camps and school buildings. So right now, our traditional school year has ended, and all schools will be open for preschool through 3rd grade, English language learners, summer camps in school buildings, and special education programs and childcare for our working families. Phase 3 is where all students will receive in-person instruction and can be accommodated with strict social distancing measures in place. And we project that we will be in phase 3 by the opening of schools. Some places in Commonwealth open up in August, some open up the day after Labor Day. But what I just want to say is that before we get to the new normal, which would probably be beyond phase 3 and probably January 2021 is our prediction, but somewhere in 2021, we have to understand that we have to prioritize accommodations for students and staff that aren't able to come into our building. So there will be a remote learning option for students and faculty and staff. And so I won't necessarily say that we're providing homeschool, but we are providing remote learning. It's going to have to be a hybrid between both, because what we can't do is we can't go back to school under the same guidelines that we started the school year pre-pandemic. So, for example, we know that we need to have 6 feet between students in the classroom with desks. And you might say, well, how are we going to do that? Because there's not enough space in a classroom of 30. Well, that means we're going to have to start being creative and using other spaces in the buildings and remote learning, and making sure that we stagger students so that we can keep everyone safe.
Thank you so much, Dr. Underwood. And we've done a previous town hall focused on education, Amir, and one of the things with the superintendents who were on that call that was the consistent point that they were making is that it really is an evolving circumstance. And just as Dr. Winn stated that, we know so much more about this disease than we did at the beginning, and the way that physicians are treating it and medical professionals are treating it, we know more than we did at the beginning. It's still evolving in terms of the precautions that we need to be taking at our schools across Virginia. So thank you for your question. And we'll continue on our website and via our newsletter to provide updates as this situation continues to evolve. But I do hope that you will get back in the classroom and that we will return to a place of learning that is good for our students and as we continue to work through this pandemic.
Thank you, Representative. I'm being told we have time for just one more question, and we've got Sonia on the line with that question. Go ahead, Sonia, you're live.
Thank you so much. Thank you for this opportunity. And Congresswoman Spanberger, it's good to talk to you again. I met you at Dr. Bowles Sr.'s homegoing a year ago or more so. I had a comment. The first comment I had was that this pandemic, COVID-19, has shown us that we have laid bare that we are all truly in this together. It has shown us that those people, not only that have the access to the best, but also those that have the least of us have access to a fraction of what is required, also need to be involved. And those populations that we are, quote unquote, in quotes, forgotten, such as those that we have an aggregate of patients, such as those in nursing homes and residential communities, those who are offenders in jails, local, federal prisons, state prisons, immigrants who have been corralled, and inner cities, and immigrants and homeless are also requiring to be treated. I was glad to hear that when I had to come back on the talk that you all discussed the social determinants of health, which are definitely those items that have affected and afflicted those persons of color and disadvantaged individuals. And I'm glad to hear you all talk about that. So this whole pandemic has shown us that all facets of life need to be has to have that multifaceted approach in dealing with things, and not just in pandemics, but just ongoing, the new normal life. My particular question had to do with education was that when the schools were closed, and I'm in rural Goochland, there is no reliable access to broadband, no platform here in order to do work. Particularly, I cannot work from home because I don't have access. And a lot of rural communities don't have access. So despite the fact that they had little sections outside of the library or whatever to go, that still takes you out of the home. I wanted to know, what is Virginia going to do about that lack of access and lack of communication and participation?
Thank you so much, Ms. Sonia, and it's good to reconnect with you after the last time we would have seen each other. I was going to enthusiastically toss the last question over to the participants, but ma'am, you asked a question about broadband, and I can't not talk about broadband. If Representative Underwood were visible on the screen right now, I'm sure she's probably laughing at that comment, because I sometimes feel like a broken record and the halls of Capitol Hill talking about broadband. But the point that you made is such a significant one. This pandemic has demonstrated the real divides that exist in our community between social determinants of health, access to food, access to housing, access to the ability to isolate and quarantine if necessary, the ability to go without a job for a period of time, and that's separate from losing a job. But when we're looking at access issues, as our schools across the Commonwealth and frankly across the country have closed down, our schools have relied on delivering online services. And this is simply laying bare the divide that exists between connected communities and communities that are not connected. In the 7th District of Virginia, we have so many homes where the ability to access the internet just isn't a possibility. It's not a question of how much you can pay or not pay. It is literally an issue of not being able to get that access. This has been an issue that's been a priority of mine for quite some time. But you mentioned, Ms. Sonia, that oftentimes people will stay at the library or they'll stay out in public. I've heard stories, parents will take their kids to the library on the weekends, or families will go to McDonald's and the parents will get a little bit of work done and the kids will do their homework. Well, in a time when we had a stay-at-home order, all of a sudden those adjustments that people were able to make to their lives in order to connect to the internet for really straightforward required things became impossible. And especially in the case of a pandemic where we have, even from a legislative perspective, passed legislation incentivizing and funding access to broadband or to telehealth related delivery of medicine. The fact that people cannot have a telehealth appointment with a physician during a time of a pandemic because they don't have access is really a significant challenge to our ability to deal with this pandemic. So I have now gone at length about how big of a deal this is. Let me tell you what it is that we're actually doing about it. In Congress, I have advocated for additional funding to the E-rate program. That's a federal grant program that allows for localities to deliver hotspot opportunities throughout the community. So it's been important to increase that funding, but frankly, that's a bit of a Band-Aid. It's a way to be reactive in this time of crisis, but it doesn't solve the problem. And much as we as a country recognize that the connectivity to the electric grid, the ability to have electricity across our communities, rural, suburban, urban, was really going to be an issue of the local economic growth and engagement at the turn of the last century, we are in the same place right now with broadband connectivity. It's an economic priority for our communities. It's a health priority. It is an educational necessity, particularly as Dr. Underwood mentioned, the phased return to schools that we'll be seeing here in Virginia. And so I led an effort with one of Representative Underwood's colleagues from Illinois, a Republican member of Congress named Rodney Davis, and we got together and wrote a letter and said, now is the time for historic level investments in what is necessary infrastructure across our communities. And we had a total of just over 70 members of Congress, Republicans and Democrats, joining with us. And so I'm proud to have pushed on that. But I'm even prouder to note that the Rural Broadband Task Force, of which I am a member, which is led by Whip and Representative Underwood as well, which is led by Whip Clyburn, a congressman from South Carolina, introduced a bill that would provide exactly that, historic investments in broadband infrastructure to try and deliver internet coast to coast. So when we're talking about the larger issue of infrastructure, which in Congress, it feels as though we are always talking infrastructure, this is the infrastructure priority that I have been relentless in advocating for, because it is such a priority. And this pandemic has demonstrated what a priority it is to our communities. So, the Band-Aid response to your question is the E-rate program, additional funding to the E-rate program. In the appropriations bills that are upcoming, I will work to protect funding to the Reconnect program, which is a USDA program that has delivered grant funding to the communities, some of the communities that I represent in the 7th District, to bring connectivity to the community. But that's not the full answer. And the full answer has to be an overall investment in the recognition that as we are working to rebuild our economy after this crisis, that this is an issue of equity, of connectivity, and it's going to be necessary for our community's future to ensure that kids are connected to school, business owners can connect from home, veterans can access VA healthcare, and that folks across the country have the same access no matter where they live. And I will get off my soapbox on that point. And if anyone would like to add anything, I welcome you to do it. I was planning to share the last question, but that one I couldn't walk away from.
Well, the only thing I would add.
I'll just add that Northam is a resident of a rural area, and the Northam administration gets it. And this is a priority of ours. The health equity leadership team, we did a town hall with thousands of our residents in rural areas. And that's the number one thing we heard was access to broadband so that they could have access to the schooling, to telehealth, as well as to testing in rural areas. And that is also the reason why that we launched Virtual Virginia. And we knew that everyone wouldn't be able to, all 132 school districts would not be able to have broadband access. And so there was a version of Virtual Virginia for our schools in rural areas that lack broadband so that they could have their classes and their lessons that they were actually loaded onto a USB drive that could be connected and handed out. But that was also a Band-Aid. And we know that we need to have a fix once and for all. And so you should know that Governor Northam is prioritizing that and really is going into the 2021 General Assembly session thinking about how can we make sure that this important equity issue is once and for all solved for all of our residents.
I just wanted to point out we have an infrastructure bill that's going to be moving this summer. And we know that when we take the opportunity to invest in our roads, we only want to dig once. And so I think that we're in the middle of some negotiations and making a strong argument about a significant broadband investment along with those roads and bridges projects, the surface transportation projects, as a matter of efficiency and getting our communities connected online. So I would say stay tuned. I know Congresswoman Spanberger is going to let you know very quickly when we're able to secure those resources to not only help Central Virginians, but also Northern Illinoisans and people all across the country.
Congresswoman, as I mentioned, we do need to wrap this call up. So if you wouldn't mind, Congresswoman Spanberger, providing some closing remarks, please.
Thank you so much to our moderator, Dirk. I appreciate that. Thank you so much for joining us. If you're joining on the telephone or if you're joining on our website, I appreciate your participation in tonight's town hall. I want to thank our incredible guests, Dr. Winn, Dr. Underwood, and Representative Underwood. I hope that tonight has been informative. I hope that you've been able to get some of the answers to the questions that are important to you. And I hope it also reflects the work that is happening at the federal level, at the state level, the discussions that are occurring across disciplines within academia, within hospital systems, within the state government, within the federal government, and that what's happening here in Virginia, our conversations are very much aligned with what are happening in our fellow states, in this case with my dear colleague from Illinois joining for the conversation. So thank you. I do hope that you all stay very safe. We've mentioned a variety of topics tonight. This town hall will be available for anybody who wants to go back and listen to it on our website. I would also note that our website under the coronavirus tab has a variety of resource guides that I do hope you'll make use of. You're also always welcome to call our offices at 804-401-4110. And we talked a lot about contact tracing and testing. And so I did want to note that the Virginia Department of Health currently is hiring more than 1,000 new employees. According to their website, you can go to the VDH website, and there are job opportunities there for community members to apply for jobs as contact tracing with a variety of backgrounds. So thank you so much to my fellow panelists. Thank you for spending the evening with me and with the residents of Central Virginia. And to everyone on the line, please stay safe, and thank you so much for your engagement in our community and with your government.